MIS-C is a post-infectious inflammatory syndrome, which means that for the vast majority of patients, that means that you've had COVID, and after you've had it for several days, or you've actually completely recovered from it, anywhere from 2 to 8 weeks later, you start to have symptoms of an inflammatory syndrome. And what that means is fever is quite universal, fever for at least one day. Many children will have fevers for unexplained reasons for up to 3 or more days. So fever is a telltale sign. But then there's also other signs of inflammation. And the ones that are the most obvious to the naked eye would be a rash. So any discoloration of the skin, looking like you have a sunburn when you hadn't gotten sun exposure, red bumps or splotches on the body. So that, along with fever, should pique the parent's attention for the possibility of MIS-C. You can also have redness of the whites of the eyes. There can be swelling or red coloration of the lips, tongue, or throat. And also the hands and feet can look puffy or red. Aside from those symptoms, there also can be quite pronounced gastrointestinal symptoms, so severe abdominal pain, vomiting, but especially diarrhea. A large amount of watery diarrhea would be a concerning symptom in the setting of having a fever as well for MIS-C. And then if there's anything else that just you think your child's unwell, they're not responding normally, they seem more lethargic, those would all be things that should prompt medical attention. So if your child has those symptoms, even in this day and age, if you don't know that they actually had COVID-19, it is worthwhile to have your child assessed. Even if a child gets COVID-19 and they're a young, healthy child, they're generally not going to get terribly ill. It may be asymptomatic, it may be the common cold. Very, very few need to be hospitalized with acute respiratory COVID. So, but what was a really important thing for us to learn was about the multisystem inflammatory syndrome. And although it affects such a small portion of the population, that is by far and away going to be, for most cases of a young, healthy child, is going to be the more life-threatening condition for them to have rather than acute respiratory COVID.